And what is fascinating is you've talked about people who've done the program here in India based on the Sector Skill Council, Healthcare Sector Skill Council's validation, are also able to seek employment outside of India because international organizations and international bodies also recognize this particular program. So people who are doing a program in India can also not only service Indian employers or clients, but also can service international people. So it actually opens up a Pandora box of opportunities for them once they're associated.
The idea, the vision of the Honorable Prime Minister was very clear. He wanted to create, he wanted to make India as what you call our country as a hub for skilling for the world, not only for India. So idea was we had the privilege of having a demographic dividend or advantage. So how do we actually create this advantage and train them, which can then be meet the needs of the entire globe. So that was the vision, and that was the idea of actually starting the Skill India mission as well. And I think that's where we are approaching to. We still have a long way to go on, but I think we have already made a strong beginning in that area, where we are already seeing some kind of certifications being recognized. So case in point again is that, for example, Government of India and Government of Japan has signed an MOU now, where they would be sending almost 300,000 caregivers from India to Japan. Yes. So that's that's some kind of things which are happening slowly across globe, and this is also being led by the government to government kind of interaction, other than the which happens at a private level as well. So that actually speeds up the entire efforts. So that's where I think that's how it is going on right now. Yes, we are looking forward to provide more and more global opportunities for our certified people as well. It is, as we all are aware, that healthcare being a very, very regulated subject. So each country has their own regulations, but we are trying to see which are the areas which are not so regulated. And if there are any things which are regulated, how we can have a government to government interaction to see that our certification is also being recognized by the regulator, even after an examination or without an examination. So I think all that is being worked out here.
That's wonderful. Thank you so much for all the great initiative you're taking and spearheading this initiative in India. And what a great job that the entire Healthcare Sector Skill Council is doing in this space. Much, much, much needed.